Good morning, everyone. Welcome to Great Day Houston. It is Medical Monday, so we have some things to improve your health, make you feel good, and save your life, starting with your heart. Heart disease is the #1 killer of men and women around the world. Sometimes there are symptoms, and sometimes a heart attack comes with no warning at all. New technology has made it easier to stop a heart attack before it even happens. Dr. Rajiv Agarwal is a cardiologist at Modern Heart and Vascular Institute and shares how easy this screening is and what to do if your heart is a beat away from a problem. Good morning.
Good morning, Deborah. How are you?
I am good. All right, first let's clear up some myths. People still believe that heart disease is mostly a men's problem.
Oh, absolutely not. Heart disease is actually very common in women. All women get mammograms, and that's great, but heart disease is actually 30 times more likely than breast disease in women. So equal to men, women need to be screened. They need to be treated for heart diseases because it's by far their #1 cause of death as well.
Yeah. In fact, the death rate from heart disease is about 50-50 between men and women. Symptoms are not always present. That's the other thing. People think, oh, no one's coming, no one's leading up to it. Not necessarily.
That's right. A lot of symptoms are unusual. Sometimes it could just be fatigue, shortness of breath, chest discomfort. Sometimes it's I just woke up, I don't feel right. But most commonly it'll be shortness of breath, tiredness, fatigue, and chest discomfort. And the chest discomfort is usually described like a pressure or heaviness on my chest, like there's a weight sitting on my chest, Deborah. And that should not be ignored. The other thing that should not be ignored is if you have any numbness or tingling in these two fingers, in your fourth and fifth finger, your ring finger and your little finger, if you get any symptoms in those fingers, that could be your only sign of heart disease as well.
Wow. All right. And the symptoms can differ between men and women, so don't count on that. Another myth is that only obese people and old people have heart disease.
Oh, absolutely not. Yes, they're at higher risk, but there are many risk factors for heart disease, including smoking, diabetes, high blood pressure, high cholesterol, and nowadays stress is playing a big role. As a matter of fact, Deborah, we're seeing a lot of patients who have had COVID in the last year plus since it's been around, and a lot of them are developing these symptoms. They come in and see us, and we are diagnosing them with heart disease, a lot of congestive heart failure, a lot of irregular heart rhythms in folks that have had COVID recently.
Yeah,
So
in fact, you've seen people in their 20s and 30s.
absolutely. As a matter of fact, just on Friday, I saw a 31-year-old guy who had COVID about a year ago, but having very typical symptoms. One thing led to another, but he's actually getting bypass surgery today. He's 31 years old, Deborah. So
Wow.
we're seeing younger and younger people.
What I love
with
about
heart
your
disease.
philosophy is that it's preventative technology. Don't wait for the heart attack to happen.
Absolutely. And with the technology that we have nowadays, within 1 or 2 seconds, we can diagnose people if they have premature blockages and calcium buildup and any form of heart disease in a very, very early stage and prevent it.
Yeah.
Why wait for heart attacks and strokes? Why not just prevent them early on?
And you do this with this CT scan. It's the most modern CT scan. Explain the difference between what somebody may have gotten a few years ago and what you have in your office.
Right. So we have a what's called a 128 slice CT scanner. What that does is it takes 128 pictures of your heart in one rotation, which is about a third of a second. So we can complete a scan in 1 to 2 seconds, Deborah. And traditionally, people have had to have heart caths or angiograms where they are admitted to the hospital to see if they have blockages. We can put them in the scanner now for 1 to 2 seconds, and voila, we can tell them what that does and tell them 100% accurately if they have blockages or not.
Yeah, you did this with me, and I got to tell you, someone asked me, did you get claustrophobic? I said, I didn't have time to get claustrophobic. It was over basically before it started, right? And then it was that 1 to 2 seconds. When we go through there and you look at our images, what are you looking at? In fact, those are my images right there.
Right. So mainly what we're looking for is to see if you have calcium buildup or plaque buildup in your arteries of the heart. And if you do, then we sit down and go over what we can do to prevent them from getting worse so you don't develop a heart attack and you don't need stents or bypass surgeries in the future. So it's all early detection, early prevention, and avoiding surgeries and procedures in the future.
Yeah, there are several things you can do, whether the protocol means adding a baby aspirin, but if somebody does need surgery, you don't just say to somebody, you've got blockage, good luck. You can guide them through the rest of that process.
Oh, absolutely. Majority of people that have minor blockages or even have major blockages, if they don't have symptoms, should really be treated more conservatively. And there are amazing medications, but most importantly, educational things that we can teach them about on avoiding those surgeries and procedures. It's definitely doable.
Yeah.
Uh, Very doable.
I got checked because I just wanted to check that off of my list, right? It's like, okay, don't need to
Yeah.
worry about that right now. Don't need to worry about this right now. But who should definitely get checked, get screened?
Good question. What I would suggest, in my experience, is that we should check everyone over the age of 50, and we should start screening at 40 if someone is diabetic or if they have family history